Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic. So the news continues to be excellent in Maryland and here at GBMC. As of this morning, there were 104 people in Maryland hospitals who are COVID-19 positive. This number is the lowest it has ever been since we started measuring. The test positivity rate is well below 1. Here at GBMC, we have 3 COVID-19 positive patients, and none of them are in the intensive care unit. Let's talk a little bit about variants. What is a variant? Well, viruses continue to change as they infect new cells. They go through a process called mutating, and certain characteristics of the virus change as the virus goes from one human to another. Now, as far as epidemics go, the importance of a variant is that a variant may create sicker patients once somebody is infected, or the variant may be more readily transmitted. So far, you've heard a lot about Delta variants. The World Health Organization uses Greek lettering. We are now up to Delta. And the Delta variants do not appear to create sicker people, but the Delta variant does appear to be more easy to transmit from person to person. Today in Maryland, 75% of people over 18 have had at least one dose of a vaccine. That leaves at least 25% who have not been vaccinated, and we will presume that they are still susceptible to getting the disease. If the Delta variant comes to Maryland in any significant way, we will have to see if 25% of people susceptible is enough to spread that virus through that group, because we know that that variant is more easy to transmit. So the punchline here, again, shouldn't be any surprise to anyone. We should still work to get all Marylanders vaccinated, at least excluding those with a good medical or religious reason to not be vaccinated, because that is the best way to protect us from having another resurgence of COVID-19 from these new variants. We don't know if the new variants will come and get a foothold, but if they do, we want to be ready. So I have enjoyed speaking with you about every 2 weeks since the pandemic started. There's not much more for us to talk about vis-a-vis the pandemic, but we would love to hear your feedback on whether or not there are other health topics that you would like us to educate the community about, to create a dialogue about. So please look for the link in this email that you got and respond. Let us know whether or not you think these communications should continue, and if so, what topics would you like us to discuss? So again, let me thank all of the healthcare workers everywhere for standing up against the pandemic. They did a fabulous job. Let me thank all of you citizens for your great work at mask wearing, social distancing, and washing your hands. And as a reminder again, we at GBMC are ready to serve you if you need us. Thank you very much.